In part 2 of chapter 17, we're going to discuss some other sudden illnesses that might occur and how to treat them. One of them is fainting, which is the brief loss of responsiveness, and it's usually not associated with a head injury. It's also known as syncope or psychogenic shock, and usually they're associated with decreased blood flow. So that can be caused by a heart rate that's too slow, if there's a disturbance in the heart rhythm, dehydration and heat exhaustion, anemia, bleeding, or if you sit or stand too long. Decreased glucose can be caused by medications used to treat diabetes and infections, and that can cause fainting if blood sugar drops too low. What to look for? If somebody has suddenly collapsed and has pale skin and lips and nail beds and clammy or sweaty skin, or if a person's about to faint, they may have the same type of symptoms as those that suddenly collapse, but they may let you know that they're dizzy or nauseous or not feeling well. So if fainting has occurred, check the breathing. If the breathing is stopped, call 911 and give CPR. If fainting has occurred but the person is still breathing, keep them flat on their back, monitor the breathing, and only give CPR, of course, if breathing stops. But loosen the tight clothing and check to see if there's any injuries. If they have fallen, and treat those injuries. Try to keep them cool by wiping their forehead, and if vomiting occurs, roll them on their side. Seek medical help if they've had repeated episodes, if they're fainting for no apparent reason, if they're not responding, or if they have diabetes or seizures or are pregnant. If you're about to faint, preventing a fall that's really hard, is important, because then that can help prevent them from getting injured. If they do collapse, take steps discussed in the other slides. And most importantly, when you think about somebody fainting, is if you're there, trying to prevent them from falling is the best thing, because obviously falling, they could hurt their head or other body parts. Moving on to seizures, there's abnormal firing of brain cells, and you'll see the body result in a movements that are very jerky, and they may not be responsive. There's different types of seizures, and they can be caused by different things like lack of oxygen, heat stroke, poisoning, low blood sugar, high fever, brain injury, alcohol withdrawal or overdose, or certain types of infections, and cardiac arrest. Convulsive seizures, you'll notice somebody suddenly falls to the ground. There's a stiffening of their arms and legs, jerky movements, foaming at the mouth, blue grayish face, eyes are rolling, loss of bladder control. Non-convulsive seizures will last only a few seconds. They're staring off into space, confused, or can't, focus, frequent eye blinking and involuntary movements. What you should do is move any objects that could avoid injury, place something soft under their head, and time the seizure. Keep people away from them as well. Call 911 if the seizure lasts longer than 5 minutes, if there's a series of seizures, any type of breathing difficulties, if the person is pregnant or has diabetes, if the seizure happened in the water, and if it's an injury-related seizure. These are some of the things to do to call 911. After the seizure, make sure to keep the airway open, monitor breathing, give CPR if breathing stops, allow the person to sleep, and stay with them until they're fully recovered. Prolonged seizures are called status epilepticus, requires immediate medical attention because it can lead to brain damage, severe dehydration, and aspiration, which could be life-threatening. Diabetic emergencies is another sudden illness. Insulin, which is produced by the pancreas, assists in maintaining blood sugar. Sometimes diabetes develops when the insulin is either ineffective or not there. There's type 1 diabetes that usually occurs and is diagnosed in childhood. It requires external insulin. Type 2 diabetes usually occurs people that are very overweight, have a sedentary lifestyle, and have certain risk factors and genetic predisposition. Gestational diabetes occurs during pregnancy, usually ends after the birth of the baby. Hypoglycemia is a type of low blood sugar, meaning there's too much insulin and or there's too little or not enough food intake, or too much time has gone by before you've eaten. Sometimes exercise can cause it, and also alcohol as well. If somebody has low blood glucose, look for, that they're alert, but they may have a sudden onset of symptoms. They might be staggering, have poor coordination. They may be angry, cold, pale, clammy skin. They might seem confused and excessively hungry, and they may have a lot of sweating and trembling. So allow a person to check their blood glucose if they have a glucometer. If not, use the rule of 15 if they don't have that, or if they show profuse sweating or shaking. The rule of 15 is give them 15 grams of sugar and wait 15 minutes, and you can recheck blood glucose at that time. If it's still low, if there's no testing available, then you can give 15 more grams of sugar. People with low blood glucose, sometimes they're prone to having severe hypoglycemia, and they may have what's called a glucagon kit, which raises blood sugar. And again, if a person has low blood sugar, they might be unable to follow simple instructions. Seizures may occur, and they may have an inability to swallow, so you want to look for those. Monitor their breathing, look for a medical identification tag. Do not give food or drink if they're unresponsive only, and place the person on his or her side and call 911. So there's different things to do when a person has low blood glucose and is unresponsive, as opposed to what we just discussed previously, where they are conscious and responsive. High blood glucose is the opposite. Usually occurs when a diabetic has too much glucose in the blood, and it's caused by not enough insulin, overeating, illness, inactivity, stress, or a combination. What to look for in high blood glucose: somebody may have a medical ID tag. It's a gradual onset. They're drowsy. They have extreme thirst, frequent urination. They might be vomiting. They have a fruity breath odor, heavy breathing, and sometimes they can become unconscious. So what should you do? Give them frequent small sips of water. And if you're uncertain whether the blood glucose level is high or low, and they are able to swallow, usually give them about 15 grams of sugar. Do not give insulin unless the person can self-administer it, and call 911 as soon as possible. This is the end of part 2, and we will finish with part 3 in the next video on the remaining sudden illnesses that may occur.